Assalamualaikum. Today we want to discuss about vitamin E. How to use this website WebMd.com. This is very most trusted, most referred for medical website. It's very good, so for your reference, for your general knowledge. Okay. First, let's say we want to study about vitamin E. Okay. Vitamin E is a vitamin that dissolves in fats. They have a link here for fat definition, but we are not going for further. It is found in many food, including vegetable oils, not oils, okay, like a palm oil, like a red palm oil. So many. So because of many sources of available in vitamin E, it's rare case people will have vitamin E deficiency, but it can occur. It can be happen in people with certain genetic disorder. We don't know. Maybe somebody have a genetic disorder that cannot extract vitamin E from the food, or very low weight premature infants. So this is the case discussed here. It's about premature infants that might be have low vitamin E. So if vitamin E is also used for many other conditions, but there is no good scientific evidence to support these other use. Okay, this is about vitamin E. Okay, so vitamin E is good if taken by mouth, by eating well-balanced diet in high fruits, vegetables, and whole grains rather than from supplement. Until more is known about the risks and benefit of taking the supplement. Okay, so it's not good to buy the supplements. It's advisable that we not to take vitamin E from this reference by supplement. It's not good advice. Okay, a type of vitamin E called vitamin E acetate that taken by vaping products such as smoke is not good. So may link to serious lung injury. It's not good for your health anyway. So this is vitamin E is rare case for the E deficiency, because we can see here a lot of source of vitamin C in our foods. So vitamin E have many names. We can see here there are a lot of name vitamin E and a lot of type of vitamin E. Okay, let's see for the use. This is a view. So we are saying for the use. Okay, the use effective for. You can read here. It's a very clear text in English, very easy English. Example. So good taking by mouth or eating it directly into your system, your digestion system. So if occurs of a vitamin E deficiency, okay, possibly effective for eczema disease, vitamin E effect, red blood low, anemia or chronic disease, blood disorder that can reduce level of protein in the blood called hemoglobin or beta thalassemia. Taking vitamin E by mouth or eating seem to be benefit to children with the blood disorder called beta thalassemia. Leakage of intravenous vitamin E applied to skin together with the dimethyl-sulfoxide or DMSO seems to be effective for treating leakage of chemotherapy into surrounding tissue. Menstrual cramps, okay, this is for women. So taking vitamin E for 2 days before bleeding and for 3 days after bleeding start seems to decrease the pain and reduce menstrual blood loss. taking vitamin E with fish oil might provide even more pain relief than taking vitamin E alone. So if you want to take vitamin E for purpose of decrease pain of menstrual for women, it's good together with fish oil. Scarring or hardening foot blood vessel in the kidney, hardening of blood vessel, or glomerulosclerosis. There is some evidence that taking vitamin E by mouth might improve kidney function in children with glomerulosclerosis. This is genetic things. This is PD things. So it's good for somebody with GCPD deficiency. This is genetics. Type of non-cancerous skin glow, granuloma annulae. Applying vitamin E to skin seems to clear up skin sore and granuloma annulae. It's kind of a cancerous skin sore, become black, become not beautiful. And it has a brain disorder. Emotion moment is like a Huntington disease. Okay, this is the use of vitamin C. Intracranial hemorrhage. Taking vitamin E by mouth seems to be effective for treating bleeding in the scalp in the premature infants, for sure. Means for the baby that maybe. So this all the usage that you can read from this website. Very good source for you to read more. So the side effect. This is the most things that we must consider before we want to take this vitamin as a diet. First, you must see that vitamin E is likely safe for most healthy people when taken by mouth, not by vape or by anything else than that. Such as if put in direct to the skin is also good, but the dose recommended is only 22.4 IU. So if you don't sure about this, you can search what the meanings of IU. But it's not. We cannot measure if we don't have the tools. So we can check your supplement, how many IU they have, or you must check IU because in most medicine are telling us in grams. So this IU I don't know. So you can check in internet, searching from internet what the IU is. Okay. Vitamin is possibly unsafe if taken by mouth in high doses. If you have a condition such as heart disease or diabetes, do not take doses of 400 IU per day or more. See, some research suggests that high dose might increase the chance of death and possibly cause of serious side effect. The higher dose, the greater risk of serious side effect. There is some concern of that vitamin C might increase the chance of having a serious stroke called hemorrhagic stroke. I'm not sure how they pronounce this. Hemorrhagic stroke, which is bleeding into the brain. Some research show that taking vitamin E doses 300 until 800 IU each day might increase the chance of this kind of stroke by 22%. However, in contrast, vitamin E might decrease the chance of having a less severe stroke called ischemic stroke. So you must consider the right dose for the vitamin E. You cannot simply just take overdose. For sure, for those that have a heart disease or diabetes, according to this website. I think this is very, very good website that we can consider to watch, to see, to read, in order to have a knowledge about the vitamin E that we want to consume. Okay. High dose can also cause nausea, diarrhea, stomach cramps, fatigue, weakness, headache, blurred vision, rash, and bruising and bleeding. Okay, this vitamin E are mostly from the oil, so that you have to be careful not to take overdose, because if you take overdose or high dose, you can cause a nausea, diarrhea, stomach cramps, fatigue, weakness, and headache. And the most dangerous one is blurred vision, rash, and bruising and bleeding. So it's not good for your health actually. So you have to very be careful, and need to refer to doctor that the taken of your vitamin E is within or under the right dose. It's about 22 per day, 22 IU per day, not more than that. When applied to skin, that you put in your skin, it's likely safe for most healthy people when applied to the skin. While rare, applying vitamin E to the skin can cause itching and swelling in some people. It's not important if it's just a small itching. It's not dangerous anyway. It's good for your because most of the vitamin source are from oil, so it's not very not safe. So it's not unsafe. It's really unsafe. Inhale the vitamin E, such as use smoke or cigarettes, vaping products containing vitamin E. It's not safe. That is a very important special precaution and warnings. Okay. So for pregnant women, it's good because as we know, the vitamin C is from oil. So it's good for your health. Vitamin E. So it's not good to take in early pregnancy, as you can see from here. However, it is too soon to know if this is important concern until more is known. Do not take vitamin E supplement during the early pregnancy without talking with your healthcare provider, such as doctor. Okay, this is, you can read it with your own. Okay, there's two conditions that dangerous for vitamin E, for diabetes and somebody that have a heart failure. Okay, vitamin E might increase. You must read here. Okay, this is consistent, most consistent. So I would like to concern about the liver disease. Liver disease, vitamin E taken for 2 years or more can worsen the insulin resistance, and when given with a liver disease called non-alcoholic fatty liver disease. So you have to concern this for NAFLD. So don't take vitamin C if you have fatty liver. But it is contrast with some ideas that vitamin E can repair your liver. But I think this is need some research. Okay. Okay, vitamin E. So this is research, maybe a research that need consideration. Okay, this is some moderate interaction with caution with the combination defined this website. So this is not the medical advice. It's just reading from the source, famous source about medical things. But we have to consult with medical doctor, practitioner, so that they can give the accurate information that needed by us. Okay, but vitamin E, it must be concerned about the combination taken. such as cyclosporine. So not to take vitamin with the cyclosporines is kind of can increase the effect and the side effect of the cyclosporine. Okay, so same goes to the another medicine you have to consider. Okay, the most important thing vitamin is an antioxidant. So there's some concern that antioxidant might decrease the effectiveness of some medication used for cancer, but it's too soon to know if the interaction occurs. Okay. So as we know, the purpose of vitamin E, as we can read from here, the use of vitamin E. So you have to be careful with the combination. So the dose are safe between 60 or 70 IU, okay, or topical natural vitamin E per day. So natural vitamin E, we must looking for the natural vitamin E source, except for those have a problem with vitamin E deficiency. Okay. So this research you can read more for the research, for the area of research, that this website can be used as your source. Thank you for watching the sharing information from this website. I hope it's going to benefit for you.